Good morning. Sorry, we lost our Wi-Fi connection. I'll just start over so that anyone who is tuning in now has the most recent information. I'm Dr. Meagan Kay. I'm a medical epidemiologist here with Public Health Seattle and King County. I'm joined today by Dr. Vance Kawakami, who is our CDC Epidemic Intelligence Service Officer. And we're here today to talk about a recent hantavirus case that was confirmed in our county. And I just want to give you a few brief updates about that before we launch into questions on Facebook Live. So thank you for joining us. Quick update, we were able to confirm late last night a third case of locally acquired hantavirus infection. We had provided an update earlier in the week that we suspected a case of hantavirus infection in a woman in her 50s who lives in Issaquah. And we got test results available last night that confirmed that infection. So we wanted to provide that information to the public. This is the third case of locally acquired hantavirus since November 2016. Prior to that, our most recent locally acquired case was in 2003. So this is unusual, and we want to make sure the public is aware of this increase in risk of hantavirus infection. And we'll get into some questions that we received through Facebook Live, and then if there are additional questions, we can address those as well. One of the first comments that we received from Mark Waterbury is that these cases in Issaquah, Public Health has said these cases in Issaquah are not related, and that of course they are. Just to clarify that point, so hantavirus is transmitted by the deer mouse. People get infected by inhaling viral particles that have been deposited in mouse droppings and urine. And so this virus is not transmitted person to person. So when we say these cases are not connected, what we mean is that they were not infected by the same deer mouse, and that they were not infected by each other. Though they're both located in Issaquah, and we've had another case in November that was in Redmond, this does suggest a cluster of cases, and we're not saying that is not the case. There is a cluster of cases, and it potentially an increased risk of hantavirus this season, though the explanation for that is still a bit unclear. There's another question from Kristen about identifying a deer mice and any advice about how to identify deer mice. So we brought some pictures that we have here. The most distinguishing characteristic is the white underbelly and white feet. Generally, these deer mice will have that, and people have said that they also, mammalogists describe them as having larger ears, though that can be a little bit hard to judge. So the most distinguishing characteristic is the white underbelly and white feet. And let's see here.
Just to clarify, that's in comparisons to the house mouse, which is about similar size, but typically is usually gray and brown entire. It doesn't have the under white belly, and the under of the tail is not white also. So
great, thanks, Vance. Another comment by Heather to emphasize that poison is not the answer. So we recommend, and CDC recommends, using snap traps as a way to eliminate rodents that are in the house. These traps are better than using sticky glue, for example, because with those live traps, they can allow the mouse to defecate and urinate, and that would increase the amount of virus that was produced into the environment. So snap traps are the recommended option for controlling rodents. If you have a heavy rodent infestation, then public health recommends consulting professionals. So pest control companies should really be consulted in heavy rodent infestations.
We also have a question from Stephanie. Her question is, having an indoor-outdoor cat, is my family at higher risk based on a transfer by him? Thank you for that question, Stephanie. So, cats and dogs are not able to be infected by hantavirus, but due to the predatory nature of cats and catching rodents, there is potentially a risk if your cat were to catch a deer mouse and bring into your house that was infected. So, I mean, the main thing with that is basically practicing precautions when dealing with any dead rodents, and there's information on our website and CDC. But basically, you're going to want to wear gloves, possibly even spray the dead body with diluted bleach, and then place it in 2 separate bags before disposing. And you can, as long as it's sealed in 2 bags, you can place it in your regular garbage disposal. And then obviously when you're taking your gloves off, you want to wash your hands with the gloves on before taking your gloves off, and then wash your hands after.
We do have a related question that's come in from Terry. Can feral cats transmit it from eating or killing them?
Yes,
No. Yeah.
Cats cannot transmit. They can potentially have antibodies to the virus, which suggests that they are infected with the virus, but they cannot transmit it further, and they cannot. They wouldn't develop symptoms. So it's basically knowing that cats, like Vance said, cats can put you in closer proximity to the rodent carrier of this, the deer mouse in our area.
We have another question from Cami. Her question is, we live on the edge of a very large wooded area south of Squak, Renton, Issaquah border. Kids play outside. I walk our dog almost daily on the trails. Any suggestions for staying safe? So Cami, I think it's an important question, since I know a lot of people in the area probably spend a lot of time outdoors. The main thing to realize, like Meagan mentioned, in regards of potential risk, is really risk to exposure of dried feces, urine, and saliva from an infected deer mouse that gets kind of like a dust that kind of gets aerosolized into the air. So typically the highest risk is going to be in kind of confined areas, maybe like an outdoor shed, possibly crawl spaces where there's not a lot of ventilation. So enclosed spaces, yeah. So when you're talking about outdoors, I think the main thing with that is basically, making sure your kids are not playing around areas where there might be evidence of a rodent's nest, and also being careful where you let your dog wander in that area. So the bottom line with that is, as we mentioned earlier, this is a rare disease. Even though we are seeing, a cluster of cases in the area, I think the risk at outdoors is fairly low in that situation.
We also have a question from Andrea, who asks, what are the symptoms to look for?
So the symptoms of hantavirus, they start out with a nonspecific febrile or fever-like prodrome illness. So that would be fever, headache, body aches, and then some people also have abdominal symptoms, so nausea, vomiting, diarrhea, and that occurs for the first few days, and then after the first few days, the symptoms will progress into developing cough, shortness of breath, difficulty breathing. It's really, really important to not delay seeking care. If you start out with those initial symptoms and then you see that your illness is progressing and it's becoming difficult to breathe, or that you have a cough that's developing, you need to seek care right away and tell your provider if you've had the rodent exposure. And like I said before, it's the deer mouse in our area.
Thank you. So Esperanza asked in Spanish, so I hope I'm getting this correct, but she asked, my son touched a dead rat on the patio, and now I'm wondering what I should do.
So rats do not carry this virus in our area, and rats are not a risk for hantavirus in our area. In our area, it's specifically the deer mouse that carries this virus. In general, though, if your children or if you've had bare hand contact with wildlife, you really should wash your hands with soap and water, warm water, and not touch your face, your mouth, your eyes before doing that.
For those who missed it when you showed earlier, could you show a picture of what that deer mouse looks like?
Sure. The deer mouse, like Vance is showing here, has the characteristic white underbelly and white feet and white on the tail. The other rodents that look similar but are different, the house mouse is a good example, does not have that white underbelly.
Ashley asks about what are things like mowing the lawn that could stir up droppings?
So the CDC doesn't specifically recommend wearing a mask or taking special precautions for outdoor work in general. If there's good ventilation, the risk is lower. The highest risk activities are for people who are either pest control workers or have an occupation where they are going into crawl spaces or enclosed buildings that haven't been opened in a while and potentially had some rodent activity in them. And in those situations, because the virus could be still viable or alive, and activities that would stir up the droppings and urine, activities like sweeping, cleaning, vacuuming, without wetting them down first, could potentially allow the virus to be stirred up into the air and then inhaled. Okay, so let's look at some others that had come in. Will anything be done by CDC, Ashley asks, or the city to thin out the mouse population? Will any new research be conducted to see if we are at greater risk here in Issaquah, Squawk Mountain? There isn't specifically anything that's going to be done to thin out the deer mouse population. The population itself has its own cycles, and the explanation for why we might be seeing more cases is complicated right now. There are a lot of factors that are contributing to that. The heavy rainfall might be part of the problem in either driving the mice closer proximity to people, driving the mice looking for dry areas and shelters closer to where people live. But also they have their own ecologic factors that contribute to mouse populations, and so increased rainfall might allow for more food to be available, and really thinning out the mouse population isn't going to decrease the risk, because the risk is always there even if you have fewer mice. And so we really want to make sure people are aware of the prevention messaging and the activities that they can do to prevent these illnesses. And I think we've gone over them, and there's a lot of really great information on our website, so we'd really encourage you to look at our website and CDC's webpage about how to prevent illness. But if you have a rodent infestation, you need to consult. We would recommend consulting with a pest company. If you just have a small amount of rodent activity, then we would recommend trapping and killing the existing rodents, doing that for a week, and then waiting, allowing time so that no new deposits are made. And then once you've killed the active rodent infestation, then you would spray using a dilute bleach solution, spray the feces and urine, and allow that to sit for 5 minutes with the dilute bleach solution. And then because it's wetted down, it won't aerosolize the virus, and the virus would have been killed, and then you can clean it up appropriately. I do want to make a point that I think is important here, is that bleach needs to be made fresh daily. So using bleach, a diluted bleach solution that you made up months prior, the bleach won't be effective. It's inactivated. It won't be effective at killing the virus. So the bleach solution really needs to be made fresh daily, and after 24 hours it needs to be discarded and a new batch made up. Okay, let's see.
I think that kind of...
I have some more questions
Sure.
here.
Do? Okay.
Live. This is from Anand. I was exposed to deer droppings within the last 2 months. Is it possible for me to proactively get tested to see if I'm carrying the virus, even if I'm not showing any symptoms?
Thank you for the question. At this point, it's not recommended by us or by CDC to do any testing on anyone that may have been exposed to deer mouse, feces or urine that's not showing any symptoms. There's no evidence that the testing itself would be helpful in that situation.
Tara asks, does the mice feces degrade over time, or does it still transmit the virus after sitting around for weeks or months?
Yeah, so kind of with that question, when Meagan kind of answered a little bit, but basically what we know is that the virus within the feces, typically, depending on the environment, if it's outside, like in the sun, it probably lasts a few hours to less than a day. If it's in a more less sunny environment, maybe like a room, it may last up for several days. And so basically what we're recommending is if you have a situation where you find feces or any urine droppings or a nest, you want to treat it as potentially infectious, and you definitely want to spray it with the diluted bleach and let it sit for at least 5 minutes before you do any kind of cleanup. But in general, if it's been feces that was sitting in an area for over a week, it's probably not infectious.
It looks like that's all of our questions right now that we're getting in live on Facebook Live. Is there anything else that you want to make sure that people really understand about hantavirus before we close out this session?
I think we've covered the main points. I just want to make sure people are aware that we have resources available on our website. If you have questions or just tuning in now, you can visit our website for information about how to identify deer mice, how to prevent illness, and what to do. And it's really just important, if you develop symptoms and you're aware of an exposure to deer mice, that you seek health care as soon as progression of illness occurs. If you're developing any cough, shortness of breath, and have had a few days of fever and body aches, headache, you really need to seek care immediately and to let your provider know about your rodent exposure. Because hantavirus is rare, it's not going to be the first thing most providers would consider, so we would just want to make sure that you tell providers about your rodent exposure, that you were exposed to deer mice, and so that they can determine whether hantavirus testing is indicated.
And our website for public health is kingcounty.gov/health, and it's on the front page. Thank you so much.
Thank you.
Thank you.